Greetings, my name is Denny and welcome to my garage. LACNets has invited me to talk a little bit today about my journey with NETs as well as share my experience having recently completed PRRT. So first, a little background on my experience with NETs. I was diagnosed in June of 2020. I had symptoms starting in January of 2020, flushing and unexpected weight loss. And in June, finally went to my doctors for some workups and determined that I had near confluent, too numerous to count lesions on my liver. I had about 3 weeks to wait between that diagnosis and actually seeing an oncologist and learning that I indeed had NETs. I'd had a biopsy in that interim and determined that there were NET neuroendocrine tumors across my liver. But no primary. They couldn't find a primary tumor, still can't. And I had a Ki-67 score of 22.4, which meant I had a high-grade tumor, but just into the high-grade area, which meant my tumors were progressing. That was a shock, as I think it is for all NET patients when they get their diagnosis. I'd been healthy my whole life. My wife and I just could not believe that I had cancer. But quickly for me, what worked was to get as much information as I could and do as much research and learning as possible to be my own best self-advocate. And I struck out reading journals, reading everything I could put my hands on, watching videos, going to virtual conferences, and joining 3 support groups up and down the West Coast. About this same time when we talked to my oncologist and also a second opinion oncologist in Seattle, we live in Northwest Washington, they both suggested starting me on lanreotide, which I did, and talked about PRRT, but talked about it in some distant future where that might be appropriate for me later on in my therapy or my treatment. And almost like it was a potential last resort therapy versus a treatment that could come earlier on in my cancer. So again, in my research that I was doing, I also discovered a video from the Carcinoid Cancer Foundation, the Lunch with the Experts with Dr. Maudlin, talking about the NET test. And I was curious about the NET test just because of how that might be an additional marker that we could track on this journey. And so I contacted Ren Labs. Dr. Maudlin actually contacted me back, and we talked further, and as well as sending me or giving me information on the NET test, he also asked if I'd considered PRRT earlier. And he said, well, don't take that off the table right yet, because he thought that could be a good first line or close to first line treatment for me. So I put that in the back of my thinking cap and also continued to do more research on PRRT as I continued my learning journey. One of the things that I learned also with my research was that it's a great idea to have a NET specialist oncologist leading your team. And I did not have a NET specialist oncologist. I wasn't even sure how many NET patients my oncologist here had seen. So I changed. I found a NET specialist in Seattle and began to see him. His review of my scans in medical records, he came to the same conclusion that because of my unknown primary, because of the numerous lesions on my liver, I also had another metastasis in my mesentery. He thought I was a good candidate for PRRT. So when he asked, would I like to start PRRT now, or should we wait a few months? I said, let's go now. So about the same time, I had yet another learning through my research that it was okay to have more than one doctor and more than one NET specialist on your team. So at the encouragement of Dr. Maudlin, he suggested I get in touch and referred me to Dr. Baudet as an expert in PRRT that could benefit me in being able to answer questions and advise me on my journey with PRRT at this part of my treatment. So I contacted Dr. Baudet, she agreed, and she's been a great resource for me, not only also agreeing that PRRT would be a good alternative for me at this point, but being an advisor with the NET test, which I was curious about. I've had 5 of those now, and we review each of my NET test results, and she provides feedback and I ask questions. So I found that it is great to have many doctors on your team, and when they all collaborate together, that's an excellent thing. Now that my PRRT treatment is completed, I have to report that the treatment itself was fairly easy for me, and everybody is different. We're all different. All of our diseases present differently. I feel great. After the first treatment, my symptoms completely went away. I no longer had carcinoid symptoms of flushing. I began to gain weight, began to get energy back, and feel more myself again. Time for hobbies like my old cars, like the tomatoes growing on a shelf to my side here. I'm a gardener, I'm a car guy, I'm also a hobby photographer, and have energy and time now for all of that. So it's been good for me, and the goal with the PRRT is always stability of disease. In an interim scan we did between treatments 3 and 4, it appears I'm also going to be a lucky one that has some reduction in my tumor load, and that was especially important to me in my liver. So my takeaways from this is to all of you and all of the NET patients, there is hope. We're all different, we're all going to respond to treatments differently, but everyone says, this is much more a marathon than a sprint. And I look at this with a long-term view of how can I have the best quality of life for as many years as I possibly can. And hopefully that will be many, many years. My message now to everyone with NET cancer is there is hope. I believe there's hope for all of us. I have seen and talked with many, many people who have learned to live with this and learned to live with it very well and very fully for many, many years. And my hope and my intention is to be one of those NET patients. Thanks for listening.